Welcome students to kind of part 2 of our Anatomy of Blood Vessels lecture. This is actually going to focus more specifically on all of the, or a good portion of the our specific kind of arteries and veins that we're going to test you on. So we're going to start with the arterial system first, and then the venous system, and then talk about a couple of kind of special circulations. So let's go to the head first. We're, again, still following, remember all of the upper systemic circulation is branching off of the aortic arch. And so we're down here in the aortic arch. And branching off of the aortic arch on the right side of the body is the brachiocephalic trunk, which becomes, here it is, our brachiocephalic trunk. That becomes then the right subclavian artery and the right common carotid artery. On the left side of the body, the subclavian and common carotid directly branch off of the aortic arch. There's no brachiocephalic trunk. So if we were looking at the right side here, if we were looking at the left side, this brachiocephalic trunk would not be present. From the common carotids, they branch then into what we call the external carotid artery and the internal carotid artery. The external carotid artery, let's start with the internal first. The internal carotid artery is what is actually then going kind of deep into your skull and to your brain, to something called the Circle of Willis that we're going to talk about in just a second. The external carotid artery then branches into all of the various arteries: superficial temporal, maxillary, occipital, so superficial temporal, maxillary, facial coming off of this arch, occipital over here, that basically are supplying the blood to the skin and muscles of your head on both the right side and the left side. Let's look at upper systemic circulation, and now specifically following not the external carotid, but the internal carotid into the brain. So you have an internal carotid on both the right and left sides of the body, off of both the right common carotid and left common carotid. But the common carotid arteries, the internal carotid arteries come into the brain, and then they kind of join up with what we call an anastomosis, which is an interconnection of blood vessels. Specifically here in the brain, it's called the Circle of Willis. And so here's your two internal carotid arteries bringing blood into the Circle of Willis here, which consists of this anterior communicating artery right here, which connects the two anterior cerebral arteries. They then connect to the posterior communicating arteries here, which then connect to the posterior cerebral arteries here, and then kind of at the very back of the circle is the basilar artery. If you kind of follow where the basilar artery is coming from, you'll see it's coming from the vertebral arteries. And those vertebral arteries actually branch off the subclavian arteries. And so we really have 4 different pathways of blood going up to your brain, and because they're all connected in a circle like this, even if one of them were damaged, let's say the right internal carotid artery was damaged, we would still get blood to the right part of the brain, kind of because blood is coming up to the brain from these other pathways and then connected in this big Circle of Willis anastomosis. So let's look at the kind of 4 ways blood gets up to the brain. Here's our common carotid arteries. Again, we have a brachiocephalic trunk on the right side, no brachiocephalic trunk on the left side. Common carotid branches directly off of aortic arch. But if we follow our common carotids, they branch then into the external carotids here, where we're getting all of our kind of skin and musculature arteries, and then these internal carotid arteries on both the right side and the left side that are going up into the Circle of Willis. If we look at the subclavian arteries, you'll see branching off the subclavian arteries are what we call these vertebral arteries on the left side and on the right side. And these vertebral arteries connect with the basilar artery, which then merges with the Circle of Willis. And so we have 4 different routes of blood to your brain, because of course it's a pretty vital organ, which is putting it somewhat mildly. Okay, let's look at now the upper limb. So upper limb circulation branches off our subclavian arteries. That's what brings the blood ultimately into your limbs, or your upper limbs. The vertebral arteries, as I just mentioned, also branch off the subclavian, but then the subclavian, so do the these thoracic arteries, which again go to some thoracic intercostal type musculature and skin. But then the subclavian arteries, subclavicle, so it travels below your clavicle, then is known as the axillary artery when it's in the armpit or axilla. And then when it gets into the arm, it's known as the brachial artery. At the elbow, the brachial artery branches into a radial and ulnar artery. The radial artery follows the radius. The ulnar artery follows the ulna. And then as we get down closer to the hands, the radial and ulnar arteries branch into a superficial arch, which supplies blood to kind of the palm of your hand, and a deep palmar arch that kind of does the back of your hand. In terms of your fingers, the digital arteries branch off of the superficial arch. The metacarpal arteries branch off the deep palmar arch, and so the digital arteries supply the fingers kind of on the palmar side, and the metacarpal arteries supply blood to your fingers on the kind of back of the hand side. All right, let's look at the abdomen. Now we're looking at lower systemic circulation. So now we're descending. We descended through the thoracic aorta, and now we're into the abdominal aorta. If we follow that down, you'll see the first branch off of the abdominal aorta is the celiac trunk. The celiac trunk has several branches. It has the hepatic arteries, which take blood to the liver. It has the gastric arteries, which here's the hepatic arteries. Here's our gastric arteries that take blood to the stomach, and the splenic artery that takes blood, shockingly enough, to the spleen. Never would have guessed with a word like splenic. If we follow the abdominal aorta down a little further, you'll see we'll get our inferior and superior mesenteric arteries. Again, the mesenteric arteries, as I think I mentioned already, are what are bringing blood out to your small and large intestines. The renal arteries here are taking blood to your kidneys. The gonadal arteries here are taking blood to your ovaries or testes, depending on what sex you happen to be. If we follow the abdominal aorta even further, we get down a little bit further, it eventually kind of breaks into our 2 common iliac arteries, and that's what's taking the blood into then the right and left lower limb, which is where we're headed next. So here's our abdominal aorta, and now we're following the common iliac artery on the one side. The common iliac artery branches into the internal iliac artery, which takes blood to kind of that inner thigh, muscle, skin area, and then the external iliac artery, which is what then takes the blood kind of further into the lower limb. The external iliac artery, once it's in the thigh, is known as the femoral artery. When it's behind the back of the knee, it's known as the popliteal artery. And then the popliteal artery has two branches, the anterior tibial artery and the posterior tibial artery. Let's follow the anterior tibial artery first, which is all of our kind of shin and the top part, the dorsal part of our foot. It's known as the dorsum. In the ankle, it's now known as the dorsalis pedis artery. That then branches into what we call the arcuate artery, and then branching off the arcuate artery are these dorsal metatarsal arteries that actually bring the blood out to your toes. If we follow the posterior tibial artery, it has a branch called the fibular artery, which supplies blood to kind of the lateral part of your calves, and then it descends down into the sole of your feet, and what we call the plantar arteries. You have a medial plantar artery and you have a lateral plantar artery, and then branching off of that is the plantar arch, and then branching off the plantar arch are these plantar metatarsal arteries that are really getting kind of the undersides of your toes. Okay, so now we're going to go to and switch gears a little bit and talk about the venous system. Again, now we're going to start not at the heart, but what part of the body are we draining blood from? This diagram here is for kind of upper systemic, so head, brain, all of that. So if we are coming from the back of the head, skin and musculature, we have the occipital vein, on both sides, right and left. The occipital veins, right and left, then merge with the external jugular vein. The external jugular vein merges with the subclavian vein. The subclavian vein then merges with the brachiocephalic vein, and then that eventually brings it back to the superior vena cava. I thought I had that wrong there. I was looking at the wrong one, but I do have it right. So occipital, external jugular, subclavian, brachiocephalic, superior vena cava, back to the heart. If we're coming from the brain, your brain is one of those areas where it has a huge blood supply, and so it also has a huge drainage. It uses what we call venous sinuses, which are these kind of really flattened out veins that collect blood quite easily. I don't care that you know all of these different names of all of these different sinuses, but collectively we refer to them as the dural sinuses because they are located in the dura mater of your meninges. The dural sinuses merge with the internal jugular vein, which then merges with the brachiocephalic vein, which then goes back to the superior vena cava. The facial vein, the superficial temporal vein, I don't know if they have the maxillary on here. Doesn't look like it's on this one. But they also merge with the internal jugular. And so if you were following the path of a blood cell, say from kind of the temporal part of your skull or from your face, it would travel through one of these veins to the internal jugular, to the brachiocephalic, to the superior vena cava. Let's do upper limb now. So we're going to start out in the fingers. Again, just like we did with the arterial part in the hand, we have kind of to deal with the drainage from both the palm of the hand and the back of the hand. From the palm of the hand, we have the kind of digital veins that are draining the fingers there on that palm side, and then the metacarpal veins, which are going to drain the fingers on kind of the back of the hand side. The digital veins connect with the superficial venous palmar arch. The metacarpal veins merge with the deep venous palmar arch. And then both of these arches then merge with the radial and ulnar veins, which take the blood back to the brachial vein. The brachial vein is known as the axillary vein once it's in the armpit. Then it's known as the subclavian vein when it's kind of traveling there along under your clavicle. That then merges with the brachiocephalic vein, which then merges with the superior vena cava to take us back to the heart. We also have two kind of extra veins here, the basilic vein and the cephalic vein. And connecting those two is that median cubital vein. Typically when they take blood from your elbow, that's where they're taking it from, is this median cubital vein right here. Both the basilic vein and the cephalic vein here, they both basically merge up here with the axillary vein, but they do really, really superficial drainage, like so skin primarily, blood vessel drainage. Basilic does medial. Cephalic then does kind of real lateral superficial drainage. If we look at the lower limb, we're going to start kind of out here in the toes. Again, we're going to look at kind of both the top of the foot and the soles or the bottom of the feet. On the dorsal side, we have the dorsal metatarsal veins. On the kind of sole side, we have the digital veins. The dorsal metatarsal veins merge with the these dorsal venous arches, superficial kind of here. The dorsal venous arch, so the metatarsal veins merge with the dorsal venous arch, which then merges with the dorsalis pedis, which then merges with the anterior tibial vein. If we look at the sole of the foot, we go from our digital veins to deep plantar arches to plantar veins, which then connect to posterior tibial veins. And then both the anterior tibial and the posterior tibial connect with the popliteal vein. The popliteal vein becomes the femoral vein when it's in the thigh. When it's up here more in the pelvis, it becomes the external iliac vein, and then as it gets kind of further and closer to the inferior vena cava, it's known as the common iliac vein, and that is what ultimately merges with the inferior vena cava to take us back to the heart. We also have some superficial drainage here in the lower limb. It's provided by the great saphenous vein, which is this long vein right here. It's the longest vein in your body. And the small saphenous vein, which is this one here, which comes from the foot and kind of merges with the popliteal vein, and then kind of the blood follows the same pathway. So there's a lot of collateral routes in terms of the venous circulation. There are kind of three special circulations that have slightly different or slightly unique characteristics. One of them was the Circle of Willis that I talked about several slides ago when I was talking about arterial supply to your brain. There's also the pulmonary circulation, which we've discussed before, and we're going to briefly review again. And then an important one called the hepatic portal circulation. So let's do the pulmonary circulation real quick, and then into that final circulation, hepatic portal. So please remember that in the pulmonary circulation, unlike the systemic circulation, it is the arteries that are carrying the oxygen-poor blood and the veins, the pulmonary veins, that are carrying the oxygen-rich blood. The arteries are still carrying blood away from the heart. The veins are still bringing blood back to the heart, but they're switched in terms of whether the blood is oxygenated or not compared to the systemic circuit. So last kind of special circulation is known as the hepatic portal circulation. And this is the drainage of all of the blood from your digestive viscera. So from your stomach and your small intestine and your spleen and your large intestine. It's all generally quite nutrient rich. And all of that blood from your GI tract doesn't directly go to the inferior vena cava. If we were talking about, say, drainage from your lower limb or from your kidneys, that connects to the inferior vena cava and takes it back to the heart, and we go system-wide again. But with the blood from the digestive system that has just absorbed all these nutrients from our food, it goes to the liver first. This allows liver to kind of detox anything that might be potentially damaging to us, but it also allows the liver to kind of process all of these nutrients. The liver carries out a lot of our metabolic functions in terms of taking the nutrients that we use or that we eat, and kind of converting them into either a usable form or into a storage form. So whether it's glucose or amino acids or any of those kind of nutrients that we need from our food, it's going to go to the liver first. And we do so using what we call a portal system. We've seen a portal system before when we were talking about the hypothalamus and anterior pituitary. We went from a capillary bed in the hypothalamus to a capillary bed in the anterior pituitary using a portal system. And what makes portal systems different from other kind of capillary systems is that the capillary is both fed and drained by a venule, as opposed to your kind of typical situation where the arteriole leads into the capillary and the venule comes out. But in this instance, we have a venule leading into the capillary and a venule leading out of the capillary. So we're going to start out in the kind of capillaries of our digestive viscera, the spleen, the intestines, the stomach. So the spleen gets drained by the splenic vein, which is this vein right here. You'll see connecting to the splenic vein is this inferior mesenteric vein. It does and drains some parts of the small intestine. The superior mesenteric vein here is a very large vein that drains pretty much most of your small intestine. And then, I don't know if it's on here, gastric vein. Oh, it's not on this picture, but the gastric vein is up here coming from the stomach, and it drains right here. So the splenic vein and the superior mesenteric vein, they merge with this vein right here, which is called the hepatic portal vein. And the gastric vein comes right in here and kind of merges with this hepatic portal vein. This then is our portal system. So we have capillaries here around our digestive viscera. They get drained by their respective veins, and all of that then merges into this hepatic portal, which brings it into the liver. So here we have a vein and venules delivering blood to an organ and into the capillaries of the liver, so that the liver can kind of do what it needs to do to the nutrient-rich blood that it just received. Once the liver has done that, then the liver itself is drained by the hepatic veins, which finally then merge with the inferior vena cava to take us back to the heart. So it's a little bit of a different kind of flow than we see kind of elsewhere in the body. And that is the end of the vascular system.